Hello guys, my name is Rafat Nas and my topic is macrolide. Topics to be covered are macrolide antibiotics, erythromycin, newer macrolides and clarithromycin. Then macrolide antibiotics, these are antibiotics having a macrocyclic lactone ring with attached sugars. Erythromycin is the first member. Then erythromycin, it was isolated from Streptomyces erythraeus in 1952. It has been widely used as alternative to penicillin. Then its mechanism of action, erythromycin is bacteriostatic at low but cidal at high concentration. Sensitive gram-positive bacteria accumulate erythromycin intracellularly by active transport, thus show high susceptibility. Activity is enhanced several fold in alkaline medium. It acts by inhibiting bacterial protein synthesis. It binds to 50S subunit of the ribosome, then ribosome fails to move along the mRNA and inhibits translocation step. Antimicrobial spectrum. It is narrow spectrum. It acts mostly on gram-positive and on few gram-negative bacteria. It is highly active against Streptococcus pyogenes, Clostridia, Corynebacterium diphtheriae, Neisseria gonorrhoeae, and Listeria. Mycoplasma not affected by penicillin are highly sensitive to erythromycin. Enterobacteriaceae and Bacteroid fragilis, which are not inhibited by penicillin, are also not inhibited by erythromycin. Then, some microbes develop resistance against erythromycin by several mechanisms. First mechanism, plasmid of the gram-positive bacteria produces methylase enzyme, which alter ribosome binding site for erythromycin and inhibit its action. Then, some bacteria they have mutated 50S ribosome. Due to it, erythromycin action is inhibited. Then they show cross resistance to other macrolides like clindamycin and chloramphenicol. Then its pharmacokinetics. It is acid labile, hence given as enteric coated tablets. Food delays its absorption. It not crosses blood-brain barrier. Its half-life is 1.5 hour. Dose not to be altered in renal failure. It is 70 to 80% plasma protein bound. Then its adverse effect, they are mild epigastric pain, nausea, anorexia, reversible hearing impairment, hypersensitivity reactions like rashes, eosinophilia, and fever. Drug interactions of erythromycin, they are erythromycin inhibits hepatic metabolism of many drugs like theophylline, valproate, warfarin, ergotamine. Due to it, their serum levels are increased. It also inhibits cytochrome P3A4 enzyme, which causes QT prolongation and ventricular arrhythmia. Then its uses. It is mainly used as an alternative to penicillin for streptococcal pharyngitis, tonsillitis, community-acquired respiratory infections caused by pneumococci. It is used for diphtheria, for acute stage as well as for carriers. It is used for tetanus, syphilis, gonorrhea, and leptospirosis. It is used as a first-choice drug for atypical pneumonia caused by Mycoplasma pneumoniae, whooping cough, and chancroid. It is used as a second-choice drug for Campylobacter enteritis, Legionnaires pneumonia, and Chlamydia trachomatis, infection of the urinogenital tract. Then newer macrolides. In attempt to overcome the limitations of the erythromycin like narrow spectrum, gastric intolerance, poor tissue penetration, and short half-life, number of semi-synthetic macrolides had been produced like clarithromycin, azithromycin, and roxithromycin. We'll discuss about clarithromycin, its antimicrobial spectrum. It is similar to erythromycin. In addition, it includes MAC, which is Mycobacterium avium complex, and Mycobacterium leprae. It is more active against Helicobacter pylori and Moraxella and Mycoplasma. It shows cross resistance with erythromycin. Then its pharmacokinetics, it is more acid stable, it is rapidly absorbed, and its bioavailability is approximately 50%. Half-life 4 to 6 hours at low dose, but 6 to 9 hours at high dose. Its tissue distribution is slightly larger than the erythromycin. No dose modification is needed in liver disease or in kidney failure. Then we'll discuss about erythromycin uses. They are upper and lower respiratory tract infections, sinusitis, whooping cough, skin infections due to Staphylococcus aureus. It is also a component of triple drug regimen to eradicate H. pylori. It is first-line drug in combination regimen for MAC infections and also AD patients. Side effects Side effects are similar to those of erythromycin, but gastric tolerance is better in clarithromycin. High dose can cause reversible hearing loss. Few cases of hepatic dysfunction and rhabdomyolysis are also has been recorded. Drug interactions are there similar to erythromycin. Then we'll discuss some MCQs. They are: first, erythromycin was isolated from sans serif D. Streptomyces erythraeus. Second, mechanism of action of erythromycin. It is by inhibition of the translocation step of the protein synthesis. Third, which is not the adverse effect of the erythromycin. It is phototoxicity. It is not the adverse effect of the erythromycin. Fourth, erythromycin inhibits which enzyme? As we studied, its answer is B. Cytochrome P3A4. Clarithromycin is component of triple drug regimen for sans serif C. H. pylori to eradicate H. pylori. Thank you.